I'm Dr. Daniel Kantor, Neurology in Real Time. I'm here and I'm joined by one of the greatest friends of all the videos we do, Dr. David Brandis, neurologist at Hope Neurology and MS Center in Knoxville, Tennessee, and by now Dr. Adam Schayek, a doctor of physical therapy, who's here doing videos and is going to be reporting back to you. David, you talked about pain in multiple sclerosis. I thought 20 years ago, you were practicing 20 years ago.
Right.
Didn't neurologists say there was no pain in MS?
Well, that used to be the thought, and then we realized that patients with MS can have nerve pain, neurological pain from lesions inside the brain and spinal cord where the pain nerves are there and they get disrupted. But it turns out that there are other causes of pain in MS as well.
Why is it that neurologists felt that way 20 years ago? Didn't they see patients the same way we see them nowadays? It seems obvious, it's self-evident that people with multiple sclerosis have pain. So why would neurologists have thought there was no pain?
Well, we used to think of MS primarily as physical symptoms and maybe cognitive symptoms. We weren't really focusing on that. But sensory symptoms, we thought, oh, they're just crazy. It's all about the physical things. And that's what we thought about MS. But as time has gone on, we realized that nerve pain occurs in peripheral nerve disease, and it can also occur in central nervous system disease, nerve pain. And so we now have neuralgia with MS. Of course, I always believed it was MS to begin with, way back.
Well, you knew what was going on. Now, Adam, when you were listening to this lecture, what did it make you think about? What kinds of questions rose to the top of your mind?
We talked a lot about kind of MS and fibromyalgia, how they could kind of coexist or be separate conditions. It's very interesting to see that, a patient could have both kinds of pain or another. And if it is, also we talked about trigger point pain and how those three kinds of pain could all be evident in the same patient or be separate. And the doctor was talking about how we could treat those different patients for the different types of pain.
A lot of people with multiple sclerosis carry the diagnosis of fibromyalgia even years before they're diagnosed with MS. Are the doctors who give them the diagnosis of fibromyalgia wrong, or are they just giving one diagnosis before the other?
Well, general doctors in specifically, but even general neurologists sometimes have a hard time making a diagnosis of MS. And when a patient comes in with pain and maybe some numbness and tingling with the pain, they might think it's a pinched nerve. But they also, some of them now realize that fibromyalgia can have pain as a symptom and neurological symptoms like numbness and tingling and weakness. So the fibromyalgia doctors are starting to learn about that. But the general doctors really don't know much about that. And even the neurologists don't know a lot about that yet.
Adam, as a physical therapist, how much do you see your role as being important in managing pain for people with multiple sclerosis and other neurological problems?
Sure. A lot of times we'll see patients, I'd say most commonly with trigger points that we were talking about. And Dr. Brandis had mentioned in his clinic they do kind of analgesic shots directly to the muscle, which is a great option to kind of lower down what's going on with the spasms. And from physical therapy standpoint, a lot of times we'll also address trigger points either with dry needling or with direct massage. And we talked a lot about interprofessionally, kind of getting those shots and then maybe having a physical therapist work with you to teach you the stretches or, the self-massage techniques that they could use to keep symptoms a little lower. So it was very interesting kind of how we would work together to decrease that pain.
I think a theme we're going to hear in the next week a lot is about togetherness. We've heard that from the beginning with Dr. Jim Bowen when he talked about the team. We're hearing it time and time again. And that's one of the great things about being here at the Consortium of MS Center's annual meeting is really having neurologists, having physical therapists, having all the array, including people with multiple sclerosis who are here at the meeting as well. I want to thank all of you for opening up your house to us and for watching. I want to thank you, Dr. Brandis, and I want to thank you, Adam, so much for joining us. Thank you so much.